All right, we'll go ahead and get started. Can you hear me okay? First of all, did everybody get signed in for a raffle? We're going to be drawing a raffle. My name is Julie, and I'll be introducing our afternoon speaker. This is Bob Dodd. He works in the OR. I'll give you a little bio about him. Bob got into the hospital as a hospital corpsman in the U.S. Navy, is how he started into this field. He received his ADN from Boone in '99. He has worked at Mary Greeley for almost 11 years. Total starting in the he's been all over the hospital here. Medical telemetry, ICU, anesthesia is where he's at right now, anesthesia support. He's also been on 6 different volunteer med-surg trips to areas of Guatemala, Ecuador, Haiti, and Kenya, where he worked mainly as a recovery nurse and as a nurse educator. We decided to celebrate for Nurses Week, celebrate some of the nurses we have within the hospital. So Bob has some great experience that he'd like to share with us. So please welcome Bob.
Is this on? Okay. Yeah, I know. Tell me about it. Well, I put together a slide program of, most of the trips that I've been on. I've been to the facility in the picture that you see up front here, the Hospital de la Familia. I've been there 3 times total. It's a biannual trip. It happens every other year for me. They actually have a permanent facility in Nuevo Progreso, Guatemala, and they have major medical teams that come from the U.S. 4 times a year, and then they also have an additional 4 times a year where they just do eyes for cataract surgeries and repairs and such. Guayaquil, Ecuador. I've been on that trip once with another upcoming trip in September of this year, and it's at the University Hospital in Guayaquil in Ecuador. And that is sponsored by Kitiapa, which is a private organization comprised of a bunch of plastic surgeons in the South, and Child Spring International, and has also been associated with Smile Train. Yep. And the next facility that I went to in Kenya, and this was in 2011, Kisumu, Kenya, that was sponsored by IVU Med, which is International Volunteers in Urological Medicine. They're based out of Utah. When I first got started in this, when I moved from the ICU here at Mary Greeley to the operating room, I had talked with Kevin Healy, who's an anesthesiologist who used to work here. He's retired, and he kind of got me started on these trips. Started out just going to Guatemala, and then kind of branching out as money became available. I was able to go on more trips. So I just thought, with Nurses Week, part of the reason for this presentation, why do we do this job? This is why I do it. As far as the volunteer medical trips go, most of the times it's about the patients and the children all over the world. This is from last year in Guatemala. She's actually 4 years old, and she weighs, I don't know, somewhere between 13 and 17 pounds. She's very small, but I wish. She was pretty cute. This is Lewis. I can't remember her name. Clarice. Children all over the world born with the same congenital defects. Ecuador, Central, South America, Guatemala. Some of it is genetic, some of it is poor nutrition in the mothers. Some of it is chemical runoff from coffee plantations and big farming outfits that can lead to congenital cleft palate, cleft lip. This was in Ecuador on the Smile Train trip. A lot of these children have to actually be dropped off at the facilities beforehand so that they can actually get their nutrition up well enough so that they can tolerate the surgeries to actually do the repairs. It's a bilateral cleft palate, cleft lip. Part of the plastics team, I have 2 plastic surgeons there and an anesthesiologist from Ecuador. Sheldon Linsenberg is on the right, and John Coleman is on the left. Those are the 2 that I primarily worked with in Ecuador, and they're the main, well, they put together Kitiapa and do the trip every year. This is one of my recovery nurses that I worked with in Guatemala. That's Teresa. Most of the times we do deal with children. I have another picture here in a minute. This is in Kenya. Different trip. Notice the facial hair. Plastic surgery, as far as cleft palate, cleft lip repair, you have 2 main components, which would be the ear, nose, and throat physicians, which work on the palates, and then you have the plastics, which work on the lips, noses. A lot of these, the initial surgeries, can take upwards of an hour or 2. That would be one component of each, so that you might get 45 minutes with ENT to actually repair the palate, and then the rest of it's up to plastics, which can take, it just depends upon the plastic surgeon and how bad the deformity is. And the thing that you also have to remember, when they repair the palates, they use an inert plastic disc to seal the palate, which means as these children grow older, they need further reconstructive surgeries as they outgrow those discs. Dr. Kevin Healy doing a caudal block for a hernia repair on an infant. In Kenya, a lot of these trips are very eye-opening, especially coming from the United States. Third world countries, everywhere. This is really how 2/3 of the population in Kenya live. Those are businesses, those are homes, and the taxis are the bicycles. They actually make money just driving people around. They have 1 seat on the rear. Guatemala is the poorest country in the world. It has been, I think, for over 10 years, recognized. A lot of our mission trips, a lot of different mission trips, end up being in Guatemala and in the surrounding countries. This is right on top of the facility, the Hospital de la Familia. This is actually a restaurant and a bar. And yes, in 3 trips, I have never eaten there. Yep, ice cream. This is in Kenya. This is actually a patient who's being transported. We recover him right outside the main operating room, and then they're transported to different buildings. Most of the countries around the world, they tend to separate patients in wards. They still use general ward rooms, which can hold 20, 30 people. And they usually, men in one, women in another, children in a third. That is a pharmacy. Notice the barbed wire. I would say this is pretty typical of a mission trip operating room. I have been in areas where there are tents, but most places they actually do have some sort of permanent facility where they'll have some equipment set up. That's an anesthesia machine that's probably 6 generations old, and if you consider a generation to be anywhere from 6 to 10 years, they're ancient. I actually, in this facility in Kenya, they had a glass bottle ether anesthesia machine. Of course, it was junked in the corner, but they had used it. On most of these trips, the people who participate in them, usually we live out of a carry-on bag. Most of our checked baggage, if you're traveling internationally, you're allowed 2 pieces of luggage that can be checked, and you can carry up to 50 pounds. And most of that is how we transport the supplies that we use on these trips. So 10 days in a little carry-on, sometimes that gets a little difficult. Dr. Kevin Healy's shoe bag there that he carries all of his endotracheal tubes in. The facility in Guatemala, we're actually a little bit spoiled. It's actually a fairly nice facility, although they have 4 operating room suites that are actually all combined together, and you basically work literally back to back. We do try and make as much privacy as we can for patients. In different countries around the world, it's not as much of a concern as it is here. Some of the places that I've actually been, that looks really nice compared to some of the places that I've been for our supply and sterilization areas. If you look at the mouse right here, this is the main operating room, and this is the kitchen and the cafeteria where we had all of our food prepared, and where actually most of the people in the facility ate, so it's kind of odd. Didn't that used to be our slogan? Yeah. I like some of the spelling. Hand washing can prevent diarrhea and pneumonia. Another cleft palate repair. I believe this patient initially had a cleft palate, cleft lip, and was coming back probably 2 years later to have another disc inserted as she had grown quite a bit. I just distinguished that one by saying a simple cleft lip palate, whereas there's only one really area that needed to be stitched back together, and it didn't involve the oral cavity or the nose. One of the most interesting things, I'd never really dealt with plastic surgery very much, and this patient was born without an ear, just a little bit of an earlobe there on the side. And when the plastic surgeon started opening the patient's chest, I was kind of, what's going on? Well, you have to harvest some cartilage from a rib to actually make the ear that you're going to put in. And they make a pocket. Usually it's 2 plastic surgeons working at the same time. They make a pocket where it's at, and then once they finish that, they slip it in and sew it shut. Let it heal. They use little vacuum tubes to kind of give it more of a natural appearance. And then about 6 months later, the patients will come back in and actually have it released so that it's actually an ear. It's all completely just for looks. I mean, there's no work to it, but you'd be surprised what a difference it makes. Dr. Tracy from here and Dr. Healy. Wouldn't be possible unless we had our physicians and our anesthesiologists that also accompany us on these trips. This was our recovery and pre-op area in Kenya, which was in between both operating rooms. And yes, that's a morgue gurney that we're using to transport patients. Yeah, dish full of cataracts. That's actually, believe it or not, that's a slow day. And as you can tell, and people who aren't familiar with surgery, those are extremely bad cataracts. When I was in Ecuador the first time, I went to a park across the street from where we were staying, and a giant iguana dropped out of a tree right in front of me and hissed at me, and I ran away. But yeah, I finally got a little bit braver and went back and took pictures. Evidently, they like to sit in trees. So there's actually 7 in there. You can't see it. It's kind of a dark picture, but there's 7 up there. I made mention of a nutrition center, nutrition being very important to palate cleft lip repair. In Guatemala, they have a permanent nutrition center where families actually drop off their children. They're unable to feed them adequately or keep their weight up, and families will travel hundreds of miles so that they can drop their children off and leave them so that the nursing staff at the facility can feed them up and get their weight up. And then we usually have a pediatrician along to make sure that there are no problems doing their surgeries. So a lot of times they'll be there sometimes years at a time away from their families. In Guatemala, we did deal quite a bit with teaching. They have their own nursing school that they run, as well as the facility. And I think her name was Bellatrix. She was one of the nursing students that seemed to hang around quite a bit. I was able to get my sister on a trip, finally. This is my sister Laura. She's a nurse over in Boone. She was able to come on this trip. Something that you don't see every day, polysyndactyly. The 2 thumbs there are fused together, and also, of course, an extra digit. On all the trips that I've been on, we always have usually college students and also volunteers, techs. We've had lawyers, you name it. We have people of every job field everywhere doing whatever they can to help. Child Spring International is one of the organizations that tends to sponsor a lot of these trips. And I wanted to make mention of all the local support staff that help us in all these areas. Some of them assist with translation, some of them with just general nursing care, rounding up supplies that we seem to be running short on. Rounding with the doctors every day. A lot of times we would spend our downtime in the evenings up in the nutrition center playing with the kids, trying to give the sisters a little bit of a break. I had the chance in Guatemala last time I was there to meet the Mother Superior of Central and South America. Pretty interesting lady. Our last Guatemala team. This includes eye surgeons, plastic surgeons, ear, nose, and throat, and also we had a general surgeon from Canada. some of our trips, our working environments do vary greatly. This is Guatemala. And Kenya can be hazardous. That was outside the window of a vehicle. And that one too. Kenya, we did run into some different problems that I haven't dealt with. Being I had to go on malaria medication. You have to take care of yourself before you can take care of anybody else. But they do have mosquito netting over everywhere. Malaria is still endemic in certain areas of the world. For my OR staff here, those plastic bags covering his arms and head, that's their version of a bear hugger. Trying to keep the patient warm because the window air conditioner was right behind Dr. Tracy, blowing on him. Yeah. That's a typical ward. You might see patients. The thing really shocked me about traveling to Kenya was most of these children that we dealt with were orphans. A lot of them ages 10 and under that traveled for hundreds of miles on their own just to come for whatever we happened to be doing at the time. This happened to be a urological medicine trip. We did a lot of different procedures. Always try and have fun. The other thing that's kind of nice about some of these trips is you can set up little side trips at the end on the side. It's all out of your own pocket, of course, but yeah, this was on my bucket list. Yeah, couldn't have asked for a better pose. And the safari guide told me that all the other animals pay attention to that, whatever it is, because he stands watch and looking for predators. If he takes off, everybody else does. So, do you guys have any questions?
How long were most of your days?
Working as a recovery nurse, which is what I mainly did. I also did education on some of the trips. Generally speaking, they're very long days. A lot of times you'll get up at 5 o'clock in the morning. Sometimes you won't go to bed before 11 or 12. And then working recovery, you're always the last one done actual working. So for nurses themselves, most of these trips, they're out of our pocket. You pay for the privilege to go. They can range anywhere from $500 to over $1,000, depending upon how far you're traveling. They may ask for you to pay for your own airfare. You also have to have an understanding supervisor at work who will let you have vacation days to actually go on some of these trips. So,
What's the time commitment date? How many days off would you have to have?
Usually it's 2 weeks. Usually 14 days. It usually includes both weekends, so 10 working days usually.
And then did you take outdated supplies?
We're allowed to take some outdated supplies. Most of the countries, though, these days are getting as politically savvy, I guess, as we are. And if we bring outdated medications and things like that, they won't allow them in, just like we wouldn't. So a lot of times the physicians and sometimes the organizations themselves will take donations for the medications that we actually do use, or they'll just purchase them out of pocket. It depends upon the trip. I've had ones where I slept in a tent, in a sleeping bag. And I've had ones where I stayed in a really nice hotel. Guatemala, the facility there also includes where the nuns live. It's not really a convent, but they also have a dormitory for all the different team members, and usually you share 3-4 people to a room.
Did you know that prior
Usually you just kind of go with the flow. So, yep.
Are there clinics set up beforehand so that
They're
surgeries
they're usually referred by local physicians when they have like a yearly trip, or they know that the teams are going to be coming. They're referred by local physicians. As soon as we get there, usually the nursing staff, we're setting up all the supplies, getting the operating rooms, the recovery, everything ready that we can do, whereas the doctors and the translators are actually seeing the patients, sometimes that have been camped out there for days, and checking them over to make sure that they're actually okay with surgery. Usually we start the day after we get there. Usually we have the ORs up and running on day 2. And we usually run until the very last day. Try and get as many in as we can. So, when we were going to Guatemala, we had military escorts from the airport to the actual facility itself, which was fairly unnecessary, but there are still buses and stuff that disappear. Getting taken hostage is a possibility. I know Dr. Healy, when he travels to Gaza on some of his trips, they put him in a bulletproof Red Cross vest before they even get him off the airplane. So.
is there any fundraising type stuff around here to help support the trips?
Most of these places do have websites that accept donations. You can look Child Spring International, Kitty Appa, hospitaldalafamilia.com. A lot of times, I personally will go around and give talks like this to different church groups and things like that that'll donate money to help out kind of with some of my expenses. But generally speaking, most of their donations are taken online or through the organization itself. No. All you have to do is care, really. We had a lawyer that was doing cleaning instruments. We've had students that aren't in the medical program that are assisting in surgeries. It depends on where you're at and the different guidelines that they have, but yeah, we can use anybody anytime. So sometimes they're kind of difficult to get into these trips, as you can imagine. Although a lot of times they're very hard to do, you get to like it. I look forward to my trips, the possibility of going on a trip every year. I would do it all the time if I was financially able. So. Yeah, I guess so. I was going to say I have one more.
Oh, very nice.
Just thought I would say have a nice day. And I actually took that picture without putting it together or anything. So.
I'm gonna have you draw names. But
Oh.
$25
So you're gonna blame me.
Yes. Yes. And white.
Wow. It's not like I work with you every day or anything.
Yeah. I have a $25 Casey's card. Julie Siebold.
Wow.
And last I've got a movie card, $25.
All right, I'm gonna go. What's that one?
Who folded theirs up extra? Nicole Swigert. She left.
Oh.
Right.
Oh, she's right there.